Hi everyone, thank you so much for joining another Lead Squared webinar. Very happy to have you here. So today we will be discussing everything in healthcare, but more specifically the tech side and embracing digital transformation. So we will cover a bunch of things, and I have two speakers with us who are going to take us through it. But before that, I will just point out a few discussion points that you're likely to hear from us. So apart from embracing digital technology and obviously the latest tech and technology that healthcare providers are using, we will also focus on some of the strategies to boost clinic productivity and revenue. So some of the areas that we will cover today are, of course, discovering the power of HIS and CRM integration to improve clinic productivity. We will also talk about boosting patient loyalty with automated engagement. We will cover the end-to-end patient journey. What we like to say, patient 360-degree, get a complete view of your patient's journey. We will talk about optimizing clinic operations. So it's all about your clinic out there. So if you've joined for that, you're in the right place. I'm going to take us through the speakers who will be sharing their expertise on the platform today. We have with us Satish, who heads Insta by Practo in the Middle East. So thank you so much, Satish, for joining us. With over a decade of experience in health tech software, ERP, and pharmaceuticals, he has played a key role in Insta's relationships with over 500 centers in GCC. You will hear from him very soon. By the way, Insta by Practo is also Lead Squared's partner. With that, let me introduce Sridhar, who heads our partner ecosystem at Lead Squared, and he is responsible for new channel sales, marketing, and startup initiatives. And of course, he brings with him 17 plus years of experience. So thank you so much, Sridhar, Satish, for joining us. A quick note to everyone who has joined us and the audience. We'd love to hear from you. If you like, if you like to share a comment, feel free to do so. If you just want to say hi, all up for that as well. So with that, over to you, Sridhar, to take it away.
Thank you so much, Shivani. Just confirming that I'm audible clearly.
Yes, you are. Yeah.
Great. Thank you so much. Thank you so much, Shivani, for that wonderful introduction and setting this off in a very lively manner. Once again, thank you, Team Practo, and thank you, Satish, for taking the time out and joining this webinar that Lead Squared has taken the effort to organize. Much obliged. Thank you so much. And while Shivani has introduced what Satish does at Practo, I'd like him to say a few words about his roles and responsibilities at Practo and maybe give a brief introduction about what Practo Insta does as well.
Yeah. Thanks, Sridhar, and thanks, Shrabani, for the introduction. Like Shrabani mentioned, I'm also very much excited to meet the audience on this topic because I can really see a huge value that can bring to the audiences. Okay, when we end the session, because primarily we are talking about the how to optimize the revenue for the patients, or how to enhance the patient experience, or what kind of how they choose a tool which will be using it either in terms of an EMR or CRM or any softwares. Okay, how they want to choose those softwares. Okay, so I'm also equally excited, and I'll give us a short introduction. So I'm Satish. I'm heading the business for Insta by Practo in the Middle East. And Practo, we provide in the Middle East the software solutions primarily for the clinics, from a smaller clinic, either it can be a small dental clinic or aesthetic clinics, to a chain of clinics or a bigger polyclinics, or to a range of mid-sized hospitals. Okay, we provide end-to-end software solutions. We stepped into Middle East around 2012, where we got our first customer, and in 2023, where now we are having more than 500 plus centers in the UAE itself. And if I take my overall Middle East customers, we have having close to some 600 plus centers across the Middle East. Okay, and the way we are growing is also looks very much promising. So we are on an average, we are adding annually close to some 100 to 130 centers in the last 3 years, where I can really see the acceptance of the product Insta in the market very well. Okay, and I can also see that the acceptances mainly came from the value what we are adding to these customers.
Okay. Sure, so brilliant. Thank you so much.
Yeah. Thanks.
Yes,
thanks.
Please go ahead.
Yeah, before we get into the topic, I just also want you to get introduced about you and as well as
sure.
Yeah.
Sure. Thank you so much, Satish. So yeah, Lead Squared is a SaaS sales service and marketing CRM based out of Bangalore. We're about 12 years old. The organization has done extremely well over the last 5-6 years. Specifically, we've grown to have a customer base of 2,000 plus customers, and we have over 250 healthcare customers spread across hospitals, health tech firms, wellness clinics, and pharma and medical devices as well. Essentially, anything that has to do with patient onboarding, patient engagement, nurturing the patient, managing the patient through the entire life cycle of the relationship with clinics or hospitals, that is an area that Lead Squared can be of assistance for healthcare organizations. We have a fledgling presence in UAE as of now. We started operations there about 2.5 years ago, and happy to report that we have just recently crossed about 100 customers in the UAE, and it is an area and a region of target for us as well. With that out of the way, about what Lead Squared and Practo do, happy to jump into the topic of discussion today, which is about strategies to boost clinic productivity and revenue. Both of us having been in sales for, I think, majority of our careers, revenue and productivity are, I think, very close to our hearts. But before we jump into actually what clinics can do, maybe to set a little context, Satish, I wanted to talk about the fact that healthcare as a segment seems to be of extreme importance in the UAE and the Middle East region. I was just going through some numbers, and I understand that the government of UAE has chosen healthcare as a specific area of focus. Roughly 10% of public spending will be on healthcare going forward over the next few years. I think the aim is to make UAE a regional hub for distribution of healthcare services around the entire Middle East as well, while also making it a medical tourism hub beyond just the Middle East, for attracting patients from, let's say, maybe Middle East, from Europe, from US, from other regions of the world as well. And towards this, I understand that more than 70% of the more than 4,000 healthcare facilities in UAE alone have international accreditations as well. So obviously, there is something which is going on in the healthcare segment in the region. And these are my theoretical viewpoints, having read up about what the healthcare segment in UAE is all about. Happy to hear from you of your on-ground experience on how the healthcare industry is evolving today in UAE.
Yeah. So you well said, Sridhar. Okay. So in terms of growth of healthcare in UAE is tremendous. Okay. And as you highlighted, UAE is also focusing themselves as an healthcare hub for a medical tourism. Okay. Among the GCC nations, and not only UAE, and they are also getting close competitors here in terms of Qatar or Saudi Arabia. Okay. So they are also on the race. Okay. On improving the medical tourism in the GCC. So why is it so? Is because you still you can see that there are a lot of travelers. They are traveling out from US or UK to India or to the other Eastern nations. Okay, so GCC countries want to get a major share out of these travelers because the travel times is only half. Okay, so they can reach nearly half of the time when they reach to India or the other Eastern regions. And I'm also interested to see one of the article what I looked into on LinkedIn. It was talking about like Dubai and Abu Dhabi are ranked as the 6th and 9th more popular medical tourism destinations in the world according to the survey of 2021. And what is interesting to see is that on that almost 630,000 international health tourists have visited Dubai alone. Okay, in the period of like 2021. Okay, which is 2021. This is like a post-COVID. Okay, it is on and Dubai also has opened up much early. Okay, its gates for the traveling. Okay, so that I think that is also would have helped UAE. And the cumulative medical expenses of these tourists is close to like 730 million dirhams. Okay, which is huge. Okay, and what this article also highlights is that there are like 3 medical specialties which gain the attentions of these medical tourists, where dermatology tops it up with 43%, followed by dentistry 18%, and gynecology, which is at 16%. And this article also highlights that what the providers where to focus. Okay, it highlights that the future growth is towards the cosmetic services, home care, and the preventive care, and also highlights that you need to embrace the digital technology to achieve the growth what it is expected. Okay, so it is also highlighting that all these healthcare providers to invest on the digital technology. Okay, so that they can wrap up with this growth what it is expected. And I can also closely relate it with my interactions with our own customers in the market. Okay, so what even COVID, like many people said that their businesses were dropped, revenues were dropped. What I can see is that the aesthetic industry is one industry where it picked up early, because of there were UAE also exporting earlier a lot of patients towards Europe for some aesthetic
Mm-hmm.
treatment. Okay, where due to COVID, the people who were going to Europe for these treatments or procedures, they have identified that there are enough providers available locally, and the
Mm-hmm.
quality of care also by considering the health. Already the government is initiating a lot of healthcare standards. The standards also very high. So I can see there is a surge in terms of the aesthetic procedures. Okay, even though in the COVID period, and also I can also correlate with the new customers what we were adding in the last like 5 6 years. If I compare a ratio of like 3 years back, we were adding the aesthetic customers only to a 10% of our overall new logos or revenues, I can say. Wherein in the
Mm-hmm.
last 2 years that has increased from 10 to 25%. Okay, so that is
Mm-hmm.
where you can see the whatever the article which was highlighting. It is also
Mm-hmm.
I can see the direct correlation with our business growth also. Yes,
Understood.
please.
Understood. So there are significant investments being made by aesthetic clinics that you're seeing certainly in terms of managing their own digital transformation and making their processes more efficient. And I think what you're saying is also ratified. I was looking at some data points where what I understand is some of these subsegments, aesthetics, dermatology, and dental care alone, this is going to be, they're estimating that this is roughly going to end up being like a 600, $700 million industry by 2030, with a CAGR of 8-9%, which is astounding growth rates for an industry, right? With
Yeah.
that level of growth anticipated, I'm sure there are a lot of players and a lot of traction must be seen there. So uh, from a clinic perspective, from a doctor behavior perspective, from an entrepreneurship perspective, are you seeing more clinics sprouting up? Is there greater risk behavior that you're seeing? Are you seeing that the market is opening up in terms of more newcomers joining the industry as well? Is this something as a trend that you're seeing as well?
Yes, yes, it is. Okay, so what I can say is that in the last 2 years, Dubai has taken up a lot of investments. Okay, in general, also I'm saying you can see in Dubai the real estate market is also growing. Okay, so whenever
Exploding,
the
yeah.
real estate market is growing and new spaces are getting created, new communities are getting created, there is a need for a
Yeah.
new healthcare
Healthcare.
healthcare
Yeah.
facilities also. Okay,
Yeah.
so that is where I have seen a lot of new clinics also coming up in the last 2 years, and
Mm-hmm.
UAE being taking an neutral stage in terms of the political things. So that is where it is also granting a lot of investments across all the countries. Okay, so
Understood.
even in they are getting investments from Russia, and recently they have opened up their investments with Israel also. Okay, so there are a
Mm-hmm.
lot of new cash flow are flowing into the region. Okay, where that is also boosting the healthcare. And
Understood.
one
So
more thing,
mm.
yeah, yeah,
Mm.
please. Please.
No, please go ahead. Please go ahead.
Yeah. So one more thing, what I want to highlight it is that by relating to the previous discussion points in terms of aesthetics and the new investments, I can see that people are much more interested to invest on these aesthetic segments. The major reason is the clinics which are treating illness, which like a polyclinic or a medical center, are primarily driven through the insurance companies. Okay,
Right.
so
Right.
where even if someone is starting a clinic in that segment, it takes for them at least a year or 2 years to get accredited with these insurance companies. Wherein if they are
Right.
starting with an aesthetic segment or a dental segment,
Mm-hmm.
the patient inflow can start for them even from the day one or in the first month itself, and the break
Right.
even is also much more faster. Okay, so that
Yeah.
is the trend I'm seeing. Earlier days, like if I can compare it to, I can 6 7 years back, the insurance market was growing. Okay, there were a lot of stabilizations happening. So that is where a lot of international players are coming and starting up polyclinics here, because they know
Mm-hmm.
that the quality will be the primary driving factor for the insurance companies. So that's where there were a lot of consolidations and a lot of investments coming for a bigger setup clinics. Okay, now
Right.
it is that focus is slightly moved towards the aesthetic and dental segments.
Yeah, I think these optional and elective procedures obviously have greater growth potential because they are not, like you said, mandated or how do I put it, bound by the norms of the insurance industry as well. So now, given that there is so much expansion happening, right? Like you mentioned, new communities come up, there is new market to be served, new players are coming up all over the place. Obviously, I think a few things become very critical then for such organizations, right? One is it's going to be a crowded market. If it is not already, it will become a very crowded market very soon. So how do you ensure that your quality of service or quality of care or your sales and marketing makes you stand out within this community of of clinics, right? That could be one thing. Patient experience, patient engagement, making sure that you're able to hold on to patients that you're actually acquiring with great difficulty after it's probably going through a large CAC process. These are areas I think that we can touch on as we go ahead to understand what are the pain points that some of these clinics face as they grow, and how is it that they can invest in technology and processes to make sure that they're able to deliver better care for their patients, right? So maybe we can pick on crowded markets and how do they stand out as an example of what clinics can do to hold on to the customer base that they have and acquire new patients as well.
Yeah. So, okay. So, in terms of the crowded market, so what is the major difference? Okay, here is that. So, your UAE, if you take predominantly, there are three major cities which are driving the healthcare
economy.
business.
Yeah.
Dubai, Abu Dhabi, as well as in Sharjah. Okay,
Right.
and if you look into the city size of it, and if you see, these cities are even smaller than when you compare any of the bigger metro cities in India. Okay, so where the competition is almost like a next wall here. Okay, it is like the competitors are sitting next to each other. Okay, and visibility to the patients are way higher. And I'm not sure whether you have got a chance to drive in certain roads in Dubai, like in Jumeirah Road and others, where you will see in every villa there is a clinic board or an healthcare facility board will be there. So it is a heavy. The competition is too heavy. Okay, and what happens is that is where now a lot of the clinics also started invested into the digital platform. Right. Okay, so I'm seeing an increasing trend. Even a small clinic with an 3-4 physicians also having a marketing manager now. Okay, because they have seen that is the only way they can pull in crowd. Yes, the word of mouth or the quality of care what they are rendering will help them to retain patients. Okay, but how to bring in new patients? Okay, that is one of the very big challenge in the market. And if you look into another difference between, okay, you'll take like an cities in India or US or UK. What happens is that here the floating population is too high. Okay, because a lot of expats are flowing into the country for work, and it is not like that they know some healthcare in the provider for last 5 years or 10 years. Okay, so every month there are lots and lots of new people flowing in. Okay, for work. So and they don't know where to go, where to get treated. Okay, either for an illness or for their wellness goal. Okay, so that is where the investments in terms of proper digital platform. Okay, this is one area which will definitely help the clinics to stand out of their crowd, and again in terms of the quality of care what they are rendering to their patients. Okay.
Got it. Yeah, that's an interesting point you mentioned, right? Because if there's a large amount of floating population, then they would rely on either word of mouth from the new networks that they're forming when they move into a city, or they would rely on review websites or platforms such as Practo itself. I don't know if you operate in the UAE, but the doctor platform or the clinic platform, they would rely on such platforms to actually get recommendations of where to go. Now, if you have to do that, then obviously it means that the patient experience at your clinic has always got to be superior, so that stuff like word of mouth and review sites actually rate you higher to be able to attract more customers.
Yeah.
Got it. So in terms of challenges that clinics face, I think one of the key challenges that we've spoken about and come across is also the rate of appointment schedules and appointment cancellations, right? The whole no-show problem that healthcare systems have across the world. I'm sure UAE also has its own share of no-show problems. Have you seen or come across clinics taking any specific steps on how to solve for this no-show problem?
Okay, so this is one of the topmost problem for any clinics who manage appointments. Okay, most of when I go to the market and here they're saying that their no-shows rates are at like 40%, 30%. Okay, 50%. So this is where, and again, what's happening is that it also depends on the crowd. Okay, most of the Dubai population are working community. Okay, and they have also very limited time available for them to get treated. Okay, and so that is where the no show rate is also very high here. Okay, so what if you look into like, and clinics are still attempting a lot of things. I can tell you what helped our customers. Okay, so if I can go through my experience. Okay, what I've seen is that in many of the places our customers have implemented the proper appointment reminder systems. Okay,
Yeah,
so
which is
yeah, where at the time of booking an appointments also the system will give the confirmations immediate that yes, your appointment is confirmed, and there are like they can set the reminders like, okay, like 4 hours before or 1 day before an appointment, the system's also reminding you. Okay, so this is like an with SMS reminders, and we have also optimized it by integrating with some third-party CRM systems like Lead Squared and others, where they have extreme connectivity with other channels like WhatsApp also. Okay,
right.
so what if you see that the opening rate for SMS is on a declining trend. Now it is ranging up to like 10%. Okay, wherein with WhatsApp the message reading, there is an opening trend is at like ranging at like 90%. Okay,
Correct.
so where with many of our customers, not many, limited of our customers have explored this opportunity. Okay, and they started communicating with the patients in terms of the WhatsApp itself. Okay, where there are a lot of additional things in WhatsApp. They can also share the location if any new customer as registering with them. Okay, the first thing is that they want to know how to come here, how to park here. Okay, so they can also send a lot of instructions over the WhatsApp.
Correct.
And that is where the patient experience for a patient getting started before they visited the clinic. Okay, earlier days the patient experience can start only after they enter into the clinic. So now with the digital space, the patient experience start much ahead. Okay, before they enter into the clinic. So this is what I have seen that it has turned the table for many of our customers in terms of reducing the no shows. Okay.
Yeah, because there is a significant cost that companies go through in getting appointments scheduled from prospective patients, and if that patient drops off, that is a cost that has basically gone down the drain, right? And I agree with you. We have also worked with multiple healthcare centers in UAE and as well as in India, where these automated journeys that are created at the time of appointment booking itself, without any manual intervention through platforms such as both of ours, we are able to see that customers are kept engaged before they arrive at the clinic to ensure that they do arrive at the clinic, right? So that is, I think, part one of the problem. Part two is once the patient has actually arrived and taken maybe or consumed your services for the first time, how do you stay engaged with the patient, right? Like with any business, and unfortunately or fortunately, healthcare is a business at the end of the day. For you to have a certain constant touch with the customer, there is an engagement process that needs to be done, which is, I think patient engagement is what we spoke about. What are you seeing in terms of patient engagement that clinics are doing differently, the standout clinics or the good performance? What do they do differently from a patient engagement perspective? What are the digital investments they're making on this journey? That would be something that would be great to hear about as well.
Okay, so in terms of patient engagement, still I can see the clinics has to go a long way there. Okay, so as I mentioned, most of the clinics are stopping their patient engagement with an SMS itself. Let's say that okay, appointments we discussed already. So similarly, whenever the patients pass the clinic, they can send an billing confirmations or a welcome message with an SMS. Okay, and most of the clinics engagement gets stopped there. Okay, there is a huge opportunity here. Okay, to engage the patients more effectively. Okay, but if we look into the space, this is not an area of an EMR or any of the clinic management systems. Okay, so the clinic management systems are designed in such a way to effectively manage their operations. Okay, or in terms of appointments or a robust insurance management system, or giving meaningful reports to the customers, which is the healthcare providers. But
Right.
the patient engagements definitely requires a third-party tool engagement, which is primarily in a CRM, where the adoption of the CRM is also very low in these segments.
Mhm.
And whenever I interacted with some customers, they have highlighted that yes, they are using CRM. Okay, I'm very much happy to hear that. But when I deep dive and ask certain questions, that for what you are using CRM, okay,
Mhm.
they will be using it only 2-3% of what
Right.
a CRM can really deliver. Okay,
Right.
and they are also using CRM as a non-integrated platform, where
Mhm.
it is again they are blocking themselves with a lot of benefits. And one more interesting thing, when I discussed with multiple CEOs, what they told is that that too in the aesthetic or dental segments, they are spending close to 20-25% of their revenue in terms of marketing.
Mhm.
Okay. So that is what they are spending, and they are getting leads, but they are not spending enough time and efforts to manage, nurture the leads or
Mhm.
retarget the leads. Okay.
Mhm.
So
Mhm.
whenever an inbound lead is getting generated, once they are getting converted as a patient, okay, they are stopping their journey there. Okay, wherein
Right.
you know the well that in marketing only the conversion is only like 20% or 15% out of the total leads what they can generate.
Yeah.
Okay,
Yeah.
but they
That
are
would be very
leaving
good.
balance 80% of the leads, where they might have touch base upon them on certain interests. Okay, but
Mhm.
they're completely missing out to target those customers. Okay, so
Yeah.
not only the clinics need to invest time and efforts on the CRM tools to engage their patients who visited them, and it will also help them to get connected with the leads and nurture them and take them back as a potential customer.
Got it. And I think also from a CRM perspective, right, the story is that unless I have access or unless it's an integrated solution with a service provider such as yourselves, I don't even have the background of what the patient has gone through with the clinic, right? So unless there is a very tight integration across the multiple digital tools that a clinic might be using, which could be a CRM, a ERP, an EMR, or whatever it is, the communication or the engagement that you do with the patient is going to be that much poorer, right? The greater the access to data you have, the greater integrations that are in place, the better is the patient engagement. And as an example, I can tell you that we have integrated the platforms across a few maternity clinics in India, where right from, let's say, a pregnant lady walks into a clinic or a hospital from at month 3, right? Now, from month 3 to the point of delivery, there are multiple checkpoints. And post delivery, there's maybe a 12-month, 18-month cycle of vaccination. This entire journey can actually be coded into a platform, and the engagement can be completely automated using the data points that are actually in the system such as yours, right? Once, let's say, month 4 appointment has happened, that information flows into the CRM. The CRM then triggers a particular activity. If that trigger does not come through, you actually trigger another engagement activity. So yes, I hear you on the fact that patient engagement is something that healthcare clinics definitely have a lot of areas to work on, and integrating platforms such as Practo with Lead Squared definitely take a large step towards that direction. And on the quality of care as well, right? I think as we jump into the patient engagement, it is obviously driven by the quality of care as well. What changes or what improvements are you seeing in terms of quality of care from your perspective within the clinics in UAE, and what steps are they taking in their transformation journey for this as well?
Okay. So the biggest advantage of UAE is that where the government itself already have taken a lot of initiatives, okay,
Mm-hmm.
to ensure that quality of care is provided to the patients, okay, that is the
Mm-hmm.
customers of the clinics. So in that way, we should appreciate the health authorities across the UAE. Okay, a lot of initiatives were taken. So let's say that even if you look into the Abu Dhabi region, where there is an audit perspective called Tasnif, okay, where they go and audit all the insurance facilities to ensure
Mm-hmm.
that there are the clinical pathways are taken care of, okay, where the patients are given proper treatments, or any unnecessary treatments are avoided. So they are doing a lot of audits and ensure that the mismanagement of healthcare is not taken care. Okay, so in that
Got
way,
it.
government already stepped in this area,
Mm-hmm.
okay, to
Mm-hmm.
manage on a high level the quality of care. So that is where again here you see that the competition also is heavy, because already your competitor is doing the same thing what you are doing. Okay, so unlike other countries, this is one of the critical challenge. Okay, because as a patient, if you step into any clinic, you may not see bigger difference. Okay,
In terms
because
of
of
processes. Okay.
standards set by
Right.
government.
Right.
So
Right.
that is where every clinics need to spend a lot of time and efforts to differentiate themselves. Okay, so even if that is why if you can look into any of the clinics into Dubai, you might be get a surprise that whether you are inside a 5-star hotel or in a clinic. Okay,
Right.
because
Okay.
that kind of investments, okay, they are doing on the clinic to differentiate themselves. Okay, uh, from the other clinic perspectives. So
Got it.
where I can see is that, okay, so since I am coming from an EMR background, I can
Yep.
also highlight that how EMR can help to improve the quality of care.
Absolutely. Yeah.
Okay.
Yeah.
So and also I'll also slightly combine with the patient experience. Okay, not only the
Mm-hmm.
quality of care, the patient experience. Okay, if the customers are having a right EMR system, the patient turnaround times can be reduced to a greater extent. Okay, from each and every touch points what they have, from the registration. Okay, till they come out of the clinic, even they can digitize the complete outpatient journey with taking a digital concerns on an platform like a tablet itself. The patients can sign, and then they can move to the physician. So when they go to the physician, if it is an insurance, the physicians will be notified that, okay, what are all the services are covered or not covered. So that will help the physician also to complete his documentation faster. Okay,
Mm-hmm.
where since the appointments are also managed well, the waiting time of the patient also reduced. So one, they
Sure.
can give a better patient experience in terms of reducing their overall turnaround times. Okay, and one more focus area is that what I have seen is that majority of the clinics were focusing on what are the services that are getting billed for the patient. Okay,
Mm-hmm.
and what is getting rejected from the insurance companies. As I mentioned earlier, this market is almost like 80-90% is driven through insurance. Okay, so many clinics are focusing this, like how I highlighted earlier that they were missing the 80% of the leads, correct, inbound leads. Similarly, here in the clinics, what is happening is that most of the clinics are not focusing on how many services the doctor has ordered for a patient versus how many such services are rendered to the patients. Okay, rendered is,
I see.
yeah, it is like an bill. So you might be asking questions that, okay, what is it important? If the patients want to take it, he can take it, okay, or else he can leave it, correct? So that might be top of mind of everyone. But unlike other industries, here the patient is not the person who is going to decide what he
Right.
needs. Okay,
Right.
the physician is the person deciding what is required for the patient based on the
Yep.
physical examination he made on the patient. Okay,
Right.
and if anything is missing here, it is directly impact the quality of care. So the doctor would have prescribed a patient like a 3 laboratory tests or 2 additional services. Okay, but if the patients have done only partial of it, okay, what kind of conclusion the doctor can come with that? Either further it might delay the decision. Once again, if the doctor want to conclude on anything, that might be delay, or whatever the doctor arrives also may not be accurate. Okay,
Correct.
so that is where they if EMR can helps the clinics to identify, okay, how many such orders are getting missed, so it will definitely help them to stand out of the crowd where the quality of care is not compromised here. Okay, so because they will ensure that there are certain orders or services given by the doctor, and they have rendered it to the patient 100%. Okay, so that means the quality
Right.
of care is taken care. And in addition to that, this is also having an impact on the revenue. Okay, so where
Right.
if these services are getting billed, then directly their revenue is also getting increased here. Okay, so this is
Right.
having benefit of both quality of care as well as increase in revenue. So this is
Got
where
it.
I can
Got it.
see as an EMR can help here, and Insta is already doing this in the market.
Understood. And these are certain set processes and ways of working. I think it doesn't matter whether you're a clinic in the area of certain critical care segments or elective segments or optional segments. At the end of the day, quality of care is quality of care because the patient has come to you expecting a certain outcome for themselves, right?
Yeah.
So it doesn't matter which segment they are, the clinic might be operating in. Got it. So you mentioned on if, so basically, if you look at it, the EMR or the operating system for a clinic, if I can call it that, becomes a very, very core component of the clinic's operations, right? So how would you advise, and especially with new clinics sprouting up everywhere, if you were to advise a person who's setting up a new clinic or somebody who's looking for a new solution, what factors do they need to keep in mind while choosing such an EMR? What are the security norms? What are the compliances? What are the different elements that somebody needs to watch out for when they are selecting a particular solution?
Okay. So one, I can go with the customers can look into a SaaS-based model. Okay, because if you see, like 8 years back, it was never existed in this market. Okay, wherein now there are a lot of options available for the customers to go with a well-renowned SaaS model. And the bigger advantage here is that this model itself providing upgrades and updates, correct? Every year it is not like that there are like multiple versions available, okay, sitting in different customers location. Okay, so where the customers get a unified version, and the benefits also, they will get all the latest advancements into it. Okay, and the other advantage here is by choosing a SaaS provider is it is easily connectable with all the health information exchanges. Okay, in UAE itself there are like 3 HIS operating: Nabit for Dubai, Riyadh for the Northern Emirates, and Malafi for Abu Dhabi region. Okay, and for an SaaS-based vendor, the customer don't need to do any changes to their environment. Okay, so this is readily available, and from the day one also they can start getting connected with these health information exchange platforms.
Right.
And if you focus on the other side of the security, okay, the customer should definitely choose vendors who consider data security as a serious business. Okay, so this is where I'm still seeing the clinics need to put a lot of focus here. Okay, and choose a trusted vendor. Okay, where they have
Satish, I'm not sure if it's true for everyone, but we seem to have lost you.
I can't hear Satish as well. Satish, if you can hear us, maybe please refresh your screen because the screen's frozen.
Yeah.
Satish, if you can hear us, please refresh your screen.
Yeah, apologies everyone. I think this is a technical glitch. Let's just wait for a minute while Satish gets online.
I just saw him back. I will just pull him.
Yeah, I think he's just logging in again. Yeah.
There you go.
Yeah. I heard both of you. Okay, but I don't know what happened.
Yeah, we couldn't hear you. Sorry, we lost you when you were talking. When you just started talking about security and compliance, and you were talking about. You mentioned the three HIEs in the different parts of UAE, and post that you were talking about the security compliances, and that's where we lost you, Satish. So maybe you can pick off from there.
Yeah. I was highlighting that the customer should also choose vendors who considers data security as a serious business. Okay. So and they can also ask questions to the vendors like, okay, what kind of security compliance certificates they got, either as an ISO or HIPAA, even though HIPAA is not applicable for this region. Okay, a certificate similar to ISO is what they can ask the vendors. And I can say that passively, if they can choose a vendor who is having a good customer base out of Abu Dhabi. Okay, why I make the statement is that because Abu Dhabi, every customers which is an healthcare provider's EMR getting audited by the Abu Dhabi Advisory Board itself called ADHIS. Okay,
I see.
every
Okay.
year the EMR is getting audited. Okay, and they will be giving findings. Okay, it is not only on the process flows. They will be asking the EMR vendors to provide the VAPT reports, okay, which is the
I see.
vulnerability and penetration test reports, okay, where
Mm-hmm.
they can easily find out that if there are any critical or high-level vulnerabilities, they will be insisting these EMR vendors to fix it within like 3 to 4 weeks of time, okay.
Mm-hmm. Mm-hmm.
If you can look into a vendor who is having like in 50 centers in Abu Dhabi, so that means 50 audits are carried out on
On the
that
platform.
on the platform. Okay,
Right.
so this is one way I'm not all worried on the customers who are operating on Abu Dhabi where it is thoroughly audited. But if they are even across GCC also, if they can choose a vendor who is operating out of Abu Dhabi and having a good customer base like in a 30-40 customers, that means that much audits are happening
Right.
year on year, and
Right.
improvements are also happening after
Right.
every audit. Okay, so
Right.
this,
Right.
this is one thing where even though if they are not having an ISO or other certifications, this will definitely help the vendors to identify the right vendor here. Okay, I have also highlighted since this market is driven like 80 to 90% of insurance. Okay, they should definitely choose a robust insurance management system, whichever
Mm-hmm.
vendor they are choosing, or else their revenue is at stake. Okay, even if
Right.
there is a delay in claim submission for a week, their cash flow is delayed by a week here. Okay, so
Correct.
this is one of the critical this is one of the critical element what they need to see. And the core of this particular webinar is towards how to boost the revenue or how to
Right.
give a better patient experience. Okay,
Right.
if you look into that perspective, my suggestion is that go with the EMRs, okay, which is open to connect with third-party systems, okay,
Mm-hmm.
through standard
Standardized
APIs.
APIs. Yeah.
Yeah,
Mm.
and also go with the vendor who is already having an experience with the connected systems. Okay, so that is where they don't need to reinvent anything. Okay,
Mm-hmm.
so they can start the better patient experience at a faster time pace. Okay, and
Got it.
easy to use. I don't know how to scale it. Okay, because this is
Mm-hmm.
one thing
Mm-hmm.
everyone will be telling that I want to have an easy to use EMR, but I
Yeah.
leave it to the customers itself on how they are going to scale it up. And another thing is that they should choose a vendor with very good support model. Okay,
Right.
because
Right. Understood. I think, yeah.
EMR segment, the support plays a vital role here.
Right. Yeah. No, these are, I think, very, very valid points. And, from our own CRM experience as well, I can vouch that most of these points that you just mentioned apply to a CRM solution as well, because it integrates and works very closely with an EMR. So data compliance, security, all of these are very important points. HIPAA compliance, though not valid in the UAE, it is something that ensures that the platform that you're using is actually very, very strongly secure and watches out for the patient's data sets. Great. So I think, Satish, we've touched on, if you look at it, what the segment is looking like, what are the steps that are, primarily if you see to boost revenue and productivity. On the revenue side, you can acquire new customers. You can make sure that you service your existing customers very well and make sure that you're avoiding any revenue leakages. And I think we touched on all these 3 points across our chat over the last 45 minutes. And just to plug in a little bit for both Practo and Lead Squared, I think the Lead Squared and Practo combination of services that is out there today ensures that customers across the various clinics in UAE would be able to reap all these 3 benefits of attracting new revenue, of ensuring that there's no revenue leakage, and making sure that the patient experience is excellent. Systems like Lead Squared and Practo combined together certainly help in clinics achieving that. I think we are at the top of our hour as well, and the time allotted as well. So maybe we can look at taking any questions. If you have anything else to add, happy to hear. Otherwise, I think we should open up the webinar for some questions from the audience as well.
Yeah, Sridhar. So one thing I just want to highlight that I'm also very much excited to hear that. Okay, from Lead Square you can create a patient journey and monitor it. Okay, I think that
Absolutely.
is a great news for the attendees whoever are there. Okay, because that is one area where definitely they will stand out in the market. Okay, and they will be giving definitely a better patient experience. Okay, because the patient will see that this clinic is taking care of me at every moment. Okay, so definitely that will be adding a lot of value.
Absolutely. And from a clinic's perspective, Lead Squared has been built on a pretty much a no-code platform. So the entire journey that you're creating is as easy as drawing a flowchart on a piece of paper. So you just have to do a drag and drop build. And we've had doctors actually in India who are little tech savvy. They've been able to manage building their own customer journeys as well, or patient journeys, if you call it. So yeah, thank you so much, Satish. I think it was great chatting so far. Shivani, over to you. If there's any questions that we need to take up, happy to look at them.
Sure. So there were some questions that came in when we promoted the landing page. We had a tab for questions. So one of the first questions that came in was, what are some of the government initiatives in the area? And my guess is area of digital transformation, and how is that beneficial for clinics and hospitals?
Okay, so Sridhar, you want me to take it up?
Yeah, I think that would be better.
Okay, so I'll tell you, there are like if you look from a patient perspective, the biggest initiative taken by the UAE health authorities are connecting to the health information exchanges. Okay, so which is again a dream for many countries. Okay, so how it adds value is that a patient who is getting treated in a two physician smaller clinic to a 100-bed hospital, the health information of the patient is accessible across all health entities. Okay, so let's say that if the patient is marked as an allergy in one center, where if the patient visited an hospital without knowing or asking the patients, the physician can find out that what kind of allergy the patient is having, or what kind of treatments were happened for the patient. Okay, so this is one of the greatest initiative in terms of digital space what the health authorities have taken. And I think every individual or every resident of GCC should get honored with this, because it's a great initiative. And this initiative is it is not only stopped in UAE. Already the Kingdom of Saudi Arabia also taken this initiative, and they have called as NAFIS. So the first phase, they are digitizing the insurance claims, where UAE has done it, that too Abu Dhabi has done it in 2012, where Dubai has done it in 2015. So KSA has started this journey now for the last 2 years, and probably in next 2 years, the health information data will also get centralized in Saudi Arabia. And I have also seen that this trend will be picking up in Oman or Kuwait also soon.
I see. Excellent. So that's sort of and if these systems all get linked at some point, you're talking of a common database across the entire GCC itself, which is phenomenal.
Yeah.
Okay.
Okay, thank you, Satish. The next question that came in was, how do I check if my clinic needs a CRM solution, and at what stage? So I'm assuming they're saying at what stage of the, I think, business process.
Understood. So I think I'll take that one, Satish, if you don't mind. At what stage? Well, to be honest, I would say that right from day one, you can look at deploying a CRM in your premises. But to be honest, at any point in time where you see that you're not able to manage the experience of your customers, or the inflow of leads through a manual Excel sheet, at any point in time when it becomes too much to actually run your business using the manual platforms that you might have, such as an Excel sheet, that would be the right time to invest in a good CRM solution. Typically, what we see is once your clinic has expanded to, let's say, anything above 3 to 4 doctors, and you're meeting maybe more than 100 patients a day, definitely that is a point where you have to go up. You have to look at investing in a good CRM solution. But yes, like I said, the smallest we've had clinics with just 2 doctors, and even single doctor clinics, dental clinics, which have been using CRM solutions. It actually depends on how much, what is the volume of patients and customers that you're handling, at which point you decide to move to a CRM solution. Yeah, so short answer would be, at any point when you see it becoming difficult to manage on an Excel sheet, that's when you need to think of going in for a CRM solution.
Okay, and one more. Satish, if you're talking, I
Sorry,
think you're frozen again.
Yeah.
I would suggest just refreshing your screen. Not
we still lost him. Yeah, that's okay.
So the other question that I have, Sridhar, because I've seen this come up quite a bit, is a lot of people have this concern about how long would the implementation take how much time would we have to wait to really get the ball rolling? So what would your response be to that?
Sure. Maybe I just repeat the question for Satish benefit. Satish, can you hear us
Yeah,
now?
yeah, I can hear.
Yeah, and we can hear you clearly. Great. So Shivani had another question: is that for solutions like such as maybe yours, the EMR solution, as well as Lead Squared, what is typically an implementation cycle, and how long do these systems take to get active for a particular customer? Maybe you can go first, and then I'll talk on Lead Squared's behalf.
Okay, so what we are seeing is that let us talk into the customer sizes. If you can look into a 10 user clinic, okay. So the actual days, if we start the project, we might take like in 7-8 days, okay, to take the customer live. And again, it all depends on what is the timeline we are kickstarting the project. And if there are like an integrations are there within CRM system on any other tools, you can add another 1 or 2 days, because if we already, like, let's say applications like Lead Square or Insta, which is already integrated, okay, so where we might need additionally 1 day to roll out the integrated system also. Wherein if it is a bigger unit, let's say that if it is like an 40-50 users, then there are like a lot of other challenges in terms of data migrations and others, so that we can go on a case to case basis.
Got it. And on Lead Squared side, to answer the same question, Shivani, like Satish mentioned, it depends a little bit on the users and the complexity of the use case as well. But for smaller customers, with excluding any complex integrations, Lead Squared typically can go live within 10 working days of from the day we start the project. For larger customers, where they might have significant more complexity in terms of their process flows that need to be designed, like I said, the drag and drop you have to create, right? So the creation of those workflows, creation of the different integrations that are required, projects can extend, up to 4 to 6 weeks as well, depending on the complexity. But usually smaller clinics, not too many integrations, simple workflows, we've seen 10 to 12 working days is what is a good time frame to keep in mind while going live with Lead Squared.
Awesome, thank you. So that's the message for everyone who's joined. 10 to 12 days or less is what I can say.
For the small guys.
Yeah, for the small guys, okay. I think it's a wrap then. I don't see anything more coming in, but I definitely like to extend a big thank you for taking out your time and sharing your insights, Satish, Sridhar. Thank you so much. And we will definitely share this recording with all those who couldn't make it today, and look out for snippets on social media very soon. But thank you so much, Satish.
Sure.
Thank you so much, Sridhar, for taking out time and doing this for us.
Yeah, thank you, Satish. Real pleasure chatting with you.
Thank you, Rani.
All right.
Thank you. Bye-bye. Bye-bye, everyone.